if you could talk a little bit about some of the challenges that hospitals have approached you about, what you're hearing from clients, and then how we're responding to their concerns or their challenges. Kristen?
So our clients in hospitals and clinics contact us for the needs that they have in their physician staffing community, whether that's from a gap or a shortage in that particular service offering. It could be due to transitions, so the hospital and physician employment models and how that sometimes changes, and how staff care can come in and really be a liaison between the old form and the new form and provide some kind of continuity and consistency during that transition period. With the aging population of physicians, there's quite a bit of turnover that happens within a practice, and our customers utilize staff care and the value that we bring in order to continue patient care and continue generating revenues for their facility.
Yeah, I would say there's no doubt one of the main reasons staff care exists is because there's such an acute shortage of providers in the marketplace. And a lot of the hospitals that we work with turn to staff care because if you think about the way the hospital is structured, they may have a medical recruitment office that may only be 1 or 2 individuals. And by being able to turn over the staffing component to a company like Staff Care that's been established in the marketplace for over 20 years, they're gaining access to providers on a national scope that they wouldn't otherwise have the resources to be able to access. So in that way, Staff Care can really partner with them to accomplish the immediate short-term needs as it relates to their patient base in a more effective way, and in so doing be more cost-effective for them long-term.
Are you finding that our clients are utilizing locums on a short-term, weekly basis, or for longer-term needs more often?
It's a good question. In behavioral health and psychiatry specifically, most of the assignments that Staff Care works on tend to be longer-term assignments. So these are assignments that can stretch from, initially 30 to 60 days. We've had providers that have remained on an assignment for upwards to a year. And that's not uncommon because, again, there's such a shortage of psychiatrists in the marketplace today. You've got more and more facilities that are trying to reach into that pool to grab onto and hold on to a psychiatrist. We tend to do a lot of work in a rural setting, and there's challenges associated with really being able to hold on to your staff in a rural setting. It might not present the same lifestyle advantages that working in a more metropolitan or urban setting might hold for a physician. And so in that way, again, I think Staff Care is ideally positioned to help those clients meet their patient care needs without really having to compromise the time that physicians can spend with their patients or the time that they have to wait to see a physician to meet their needs.
I do think that hospitals and healthcare systems have evolved in how they choose to utilize locum tenens services to supplement their strategic goals. So 20 years ago, facilities would typically utilize locums for a week of vacation coverage, say. My physician is out for a finite period of time and I need someone to come in and fill that gap. And what we've seen throughout the changes in the industry and the improvements in the industry is that facilities and healthcare systems are seeing locum tenens firms more like a business partner. And how could I utilize independent contractors in addition to my permanent staff to have a more well-rounded staff and skill set and offerings out to my community? And that makes it very exciting because that means that Staff Care can really meet a need in a different way, not just a placeholder, but maybe more so from a strategic initiative standpoint to really help that healthcare system meet their goals within the community.